say something, you say no.
All right, welcome back. Now let's take our conversation outside the shores of Nigeria, the United States to be precise. The United States has a large chunk of the total number of confirmed cases in the world. The world stands at over 4 million confirmed cases, while the United States has over 1 million cases just in the United States. And we know that New York has the highest cases in America. Let's take a listen to a guest joining us via Skype. She is Princess Ibekwe. She is leader in public health system in Georgia in the United States. Princess, good morning and welcome to News Hub.
Good morning.
All right, let's begin from the fact that United States has, I would like to say, 1/4 of the total number of confirmed cases in the world. And it's quite worrisome because United States is, well, I say the headquarters of the world. It's a country that a lot of other countries look up to in terms of solutions to many problems. And coronavirus is one of such problems. We're looking up to the United States for some solutions. Right now, we know that the summertime is already at hand. We've seen people going out to the streets. Some states are easing their lockdown. But really, tell me the picture of the United States now in fighting coronavirus in your state, in Georgia.
Thank you for the opportunity. Coronavirus, I think when it came, most people actually, we underplayed it, including the United States of America, which as a public health nurse, I was very nervous that happened. But I will focus on the state of Georgia right now. I remember the first time the news broke out and we had an emergency call with the Commissioner of Health and the governor. We are making plans. As of when we are making plans, I believe we were kind of behind in the game then. And, everybody knows what's going on right now in the United States. So as a public health nurse, we were behind in the sense that when it broke out in Wuhan, when China was experiencing it, we should have been getting ready for what is to come in the United States, but that wasn't the case. However it is, we did get in the game very late, and all the necessary preparation in every aspect we were lagging behind. Fortunately, it cost lives. People were dying, and hospitals were scrambling, struggling. I know some of my friends, I had to give them some, mask because they don't even have it in the hospital. That shows lack of preparation for Georgia, and I'm sure that goes to other states also.
The conversation has moved away from lack of preparedness for COVID-19 in the U.S. So we all know, it's a known fact that the U.S. took it a bit too lightly, and then so we are faced with what we are faced with right now. But let's look at how we have dealt with it. Let's look at policy statements. Let's look at positions that government has taken all through this COVID-19. How satisfied are you at the approach that the government at the center are giving to the fight against COVID-19 in the U.S.?
Well, I will say initially when it started, like we already said, I wasn't satisfied. But moving forward, we can only move forward because we can correct what has happened, but also that's an opportunity for other countries to learn from those mistakes and plan better and be more prepared. Currently in Georgia, when we first started testing for COVID-19, which I'm responsible for one of the test sites, we were testing about 10. The first day we tested symptomatic patients, we tested 10. As of this past Saturday, we tested 100, people in a community. Just when I say county, it's like a local government. So we are more efficient in our testing. But at the same time, just because we have the ability or the capability to test 2,000, 4,000 people in a day, the lab is not ready for that, to be able to handle that capacity of testing. So with that being said, when the lab is not equipped to handle all the testing, what happened is that we have people that we have tested and they are anxious trying to find out the results in maybe 2 days. It's taking 7 days, it's taking 10 days. In the meantime, they are quarantined at home, not knowing what to do until the result come back. So, you know, the efficiency right now is that we're testing more. That's one. We're lagging in the result. But at the same time, also, sometimes in March, the president issued out some checks to individual, which is, money. And that was able to help people to be comfortable to stay at home. Because the main thing with coronavirus, like I keep telling people that don't have symptoms can still transmit it. So usually when you're sick and somebody says stay at home, you feel, okay, I'll stay at home. But when you don't feel sick and you don't even know you have the symptoms, you're up and about, you're going to the bank, you're doing stuff. Just because you don't have symptoms doesn't stop you from getting other people sick or even causing somebody to die if they do get it from you. So just staying at home, when Georgia was locked down, for almost 6-7 weeks. We reopened Georgia last week, about a week now. And from my standpoint, I'm curious and I'm nervous and I'm worried. By next week, I will know where we are as a state, how we are moving forward, because now that the state was reopened, I want to know what's going to happen, what the numbers that will come in next week when we are testing people will look like. And I pray that the numbers will come down, because if it goes up, I'm afraid we might go into where we have to lock down Georgia again, because those people that have been out for the past 1 week, in their mind, coronavirus is kind of history because the state has been reopened, which is not true, because I'm still testing and I'm still calling families will report with the result of their test.
Georgia is the 8th most populous state in the United States. And we know that a lot of African Americans also reside in this area. There are reports that this coronavirus is really, affecting African Americans. I want to know how much African Americans in Georgia are taking this coronavirus seriously and protecting themselves, if they are.
I would say they are. We have a large population of African Americans. I would say they are taking it serious. I have friends, I have colleagues, and on Facebook, I remember when the state was reopening, one of the areas that opened were salons, barber shop, which is where most African Americans hang out. And it was more like a campaign, silent campaign, people reaching out to families and say, hey, yeah, including me, I had to cut my hair at home, So it's a matter of education, and people in healthcare, people in the community, leaders, churches had to get involved and speak up and say, hey, yeah, the state is reopened, quite right, but we do have obligation to still stay in the house. We're having online church services, so many things. So it's open, but I know I drive past my barber shop where I go and cut my hair, and it's still closed, and that gives me joy. That means people are actually listening to community leaders, their pastors. Churches are not open, and those are voices that African American listen to their community leaders. So even though it's open, life is not back to normal. But I will say that I was disappointed. I saw where people are lined up to get Air Jordan somewhere here in Georgia. I can't remember what city that was, and I was very disappointed, because that kind of makes it look like we are not serious. I think this is not the time to worry about what product is out there, because people are still transmitting it, and reopening Georgia gave that sense of false that coronavirus is disappeared. It's not. It's still there. So, but I do know that high number of African Americans were dying at a higher rate than the white counterpart or any other group in the United States. Different different things can be attributed to that, socioeconomics and knowledge and all that. But make no mistake, the African Americans are aware of those numbers, and the community is working to encourage people to still stay home. It is difficult because people are losing their jobs, but I also believe we have to be alive to plan for the next day.
Princess, there has been this back and forth about states wanting to reopen their economy. It's been a struggle for some states. And then, we can see that, but the government at the center still seems open to reopening the economy. It was obvious that the government is stuck between saving the lives of the people and also saving the economy. And so we now have what we call tactical reopening of economies. Figures have shown that every economy that had opened in recent times, if you use Germany as a case study, even Wuhan too, recently, in China, seem to have a resurgence of COVID-19. What would you think is the exact thinking of governments that are reopening economies?
As most people already know, United States, we have, people have rights, people have freedom. So sometimes when you ask somebody to stay home, I know people are protesting in some states. Georgia, I don't think I've seen any protest that, the government is infringing on their rights. So that's, I'm not speaking as a government, I work for the government, but personally as Princess, I'm speaking in the sense that motivates people. Governments are trying to listen to the people. At the same time, this is election year, so people are also mindful of how not letting people go back to work or not honoring the rights of citizens will affect them. So in a way, I can see it's apolitical, but at the same time, I always see human lives first before anything, and that's, I think, what kind of took me to the area of healthcare, about saving lives. So it's political, and unfortunately, people are dying. I see the numbers every day. I call families. I know there was, I called a patient, a resident yesterday that was supposed to be tested, and I say, I called the phone and I say, you missed your appointment. Would you like to reschedule? And the son answered the phone and said, oh, I'm sorry, my mom already died. So that's the reality that I see. So whether the state will open, I know, of course, we have to open at some point, but with the numbers I'm still saying, I don't think it's the best time to open, but that's beyond, I can't control that. But I do know half of it is political, half of it is the rights of the citizens trying to exercise their rights, which, the governor respect that.
All right, that's a quite sad narrative, but looking at it from another dimension, still on COVID-19, there were some reports that some children have needed intensive care due to illnesses linked to COVID-19. It's not yet certain if it's COVID-19 or not from the reports we get. I don't know if the government is looking into that area where children are also taken ill.
They are looking at it. So what happened with it, like when it first started, there were reports that it's older individuals, 60 and above, that, has more impact from COVID-19. So kind of children or people younger, people are not looking out for them. But as time goes on, that changes. That's one of the things with COVID-19. It just changes every week, different things. But as evidence shows, as more testing are being done, we're testing, as of last week, we tested a 16-month-old child, 18 months, 2 years old. So the more you test, you find those positive cases, but they are being taken care of just like the adults. As long as you show symptoms, we go by the same. There is not, it's not like we have a different treatment for kids than the adults. There's really no treatment, right? It's mostly symptom management for coronavirus right now. So when we do identify those kids, whether you're 1 year old, 10 years old, 20 years old, adults, once you're diagnosed and the test result shows that you're positive, it's the same process. Quarantine, taking care of them. So it's not like we have priority on who. The only reason why it looks like kids were not upfront is because they were not showing symptoms, and some of the early research was suggesting that it's only people that are 60 and over that it affects.
You know, you are on the front line as a public health practitioner. Can you just take us through the process? We all know that there is no vaccine for COVID-19. There's also no cure for COVID-19 right now. But we see people taken into custody, or rather into isolations, and then we also see people recovering and being discharged. Take us through the process of an attempt to treat COVID-19.
Okay. So, like I said, most time if you're so those that are symptomatic, who are the people that have symptoms, either coughing, shortness of breath, they go to the hospital and they kind of try to manage the symptom with antiviral medication. I know there were some talks about chloroquine at one point. They try to manage that, but the biggest part of it, the hard part of it is when the X-ray shows pneumonia on both lungs. And then, you know, there's really no medication. So they just try to manage symptoms, do therapy to try to get that individual moving or to recovery. So that's one part when they're in the hospital. But then once you're in the hospital, you're already in the hospital, right? We didn't get it up front. But from my own end as public health is that we identify those people when they come and get tested, and then we'll let them know, hey, when we call you, if you're positive, this is how you proceed. You're going to be contacted by the epidemiology, and they will monitor you and they will follow you for 14 days. Have in mind, once you're positive, the epidemiologists, when they reach out to you, they will do what we call contact tracing. So the question is going to be, you were tested positive yesterday. Let's go back to the past 14 days. Who were you in contact with? Because now we're worried. Thank God we've identified you. Now we can quarantine you, self-isolate you. Most times they don't, 80% really don't have symptoms, it's mild symptoms. But then we keep going, tracing back to everybody that person has been in contact with to know how to prevent those people. Because if you identify one person and we don't care about every other person that they have been in contact with, it's going to keep spreading. That's really how we've kind of tried to manage it. One of the hospitals that I used to work, I get excited when they show me video, when I go on Facebook and I see they have like a big celebration because, you know, we talk about the number of deaths. We do have a lot of people that are recovering and going home. But at least, as far as I'm concerned, one death is huge. It takes a toll on the family. So people are recovering from it, but the biggest thing to do is to prevent yourself from even getting it in the first place. That's when staying at home is important, hand washing, wearing masks. I know some of the things we've been able to do in the United States to manage it. Like I was very impressed when Nigeria did not go as long as United States go for the lockdown, which was very impressive. I was also impressed when I heard someone like, I don't know if people know him, Father Dibia Mario. He's in Delta State, and he was giving like public service announcement, trying to let people to stay at home. Those are the ways to combat it, that it doesn't get to where you're in the hospital. I do have some of my friends in the hospital, in the healthcare, that got it, and thankfully, at least 4 of them has recovered right now. But the older ones is hitting them harder because they have other comorbidities.
All right, Princess, I would like to, thank you as a frontline worker in the effort you have put in so far in helping patients, whether with coronavirus or without coronavirus. Thank you. But before we let you go, Georgia is one of the states that I think has been applauded by some health organizations, saying that Georgia seems to have been more proactive than other states like New York and California that have recorded a high number of cases in their states. What did the Georgia, government do differently that other states perhaps haven't emulated?
Well, of course, Georgia, we can't compare Georgia to New York. New York is big. And lots of their transportation system is major, is subway. People take train, they take the bus. Georgia, it's not a lot of, mass transportation going on. We drive a lot in Georgia. So that would be one of the things that probably helped Georgia. But we have to remember that if New York was first hit, people are learning, we're asking questions. The governors are, communicating. Representatives of states are communicating, trying to see, okay, how did New York get to where they are, and then preventing measures were taken for Georgia. So that's one of the things, was that communication kind of helped guide us on how to proceed. Then that first week, the governor was he's having news conferences. We'll be on news conference like sometimes 2-3 days a week. Once he's going on TV, we have to, if I'm in my office, we'll have to turn on the TV and watch the news because things constantly changes. But I think what really helped Georgia right now was that he increased the testing capacity. Initially, like I said, we were testing 10 people, 20 people. Now we're testing about 100 in my own community daily. But those tests, he made it available. As of 2 weeks ago, the governor implemented that we have to work 7 days. Usually public health or government workers, you just work Monday through Friday. Now we work Saturday. Now we work Sunday. So it's making that testing available to more people. It's helping because the more people that are tested, we find out who is positive, and then they can quarantine or self-isolate.
Princess, we should be letting you go now, but let me just throw this to you. I'm sure the most cheering news that could hit you or hit the airways right now will be that there is a vaccine for COVID-19. Tell me, what are you hearing, and how much do you anticipate a vaccine for COVID-19?
They are working very hard. I know I was listening to the news yesterday. Emory University is one of our big universities, and it's a healthcare system also. It's a combination medication, Redisvir, and I can't remember, I wish I wrote it. I can't remember the second one. So it's hopeful. They are testing patients right now. But even if the vaccine, is successful and it comes out, it's not, there are processes. I know for a vaccine to come out there in the market, it's probably going to take anywhere from 6 months to a year. So, but they are really working hard, and other countries too are working hard. So I'm hopeful. I'm hopeful that in no time, hopefully they should be able to get a vaccine for this. And that's, like you said, that would be the best thing that can happen. That doesn't stop coronavirus from, but at least there is hope that if you do get it, or people that have not gotten it, you can have a preventive vaccine against it.
Well, the world can certainly not wait for a vaccine, but thank you most kindly, Princess Ibekwe Onweme, a public health nurse in Georgia, United States. Thank you for your time with us on the program. And please stay safe, protect yourself.
Thank you. Thank you. Have a wonderful day.
And you too. Thank you so much. All right, we'll take another break, and when we come back, we still have another discussion for you. Please stay with us. We are here every day of the week.